Hi everybody, it's Dr. Abraham Alboher here from Offen Eye Associates. Today we're going to be talking about dry eyes, and in particular a condition known as Meibomian Gland dysfunction and a possible treatment for that condition, which is the Lipiflow procedure. So many people actually experience dry eyes, and there's a variety of reasons why that is. One of the main reasons for a lot of patients happens to be that they have this condition known as Meibomian Gland dysfunction. Symptoms of dryness typically include, a burning sensation, itchiness, a lot of tearing actually, which is counterintuitive because we think that if you tear, the eyes are not dry, but actually that's the body's response to try to make the eyes less dry. Another thing that people might be feeling is a foreign body sensation, feels like something is inside the eyes, and these are all very common symptoms of dry eyes. So what Meibomian gland dysfunction is that we have glands that line the eyelid margins, both top and bottom, and that helps to create a nice clear oil that helps the tears from evaporating and keeps the eyes nice and moist. So when there's damage to those glands, or when the oil begins to back up and harden, and we're not getting that nice clear oil on the surface of the eyes tend to feel a lot drier. A few different causes for Meibomian gland dysfunction. There can be environmental factors. Genetics plays a component in this as well. We believe that increased computer use recently is causing a lot of issues, especially for younger patients that didn't have this in the past. And even certain medications that people might take actually can contribute to the glands either dying or not functioning as well as they used to. We'll go over some of the scans that we take now on certain patients to just see how their glands look. On one side I have normal looking glands, and on the other side I have some gland loss or gland dropout, and we'll take a look at that right now. So you can see here, this is the bottom eyelid, this is the top eyelid of a patient with normal healthy glands. So each one of these long white strips is a normal gland. And you can see it starts at the lid margin here and goes all the way back in a nice straight line. That's a really nice healthy gland. It's secreting oil right on the lid surface here, and you can tell we have quite a few of these on both the bottom and the top lids here. And for the most part they start at the lid margin and they go all the way back. That's really nice and healthy. They are starting to turn a little bit here at the end here, but that's relatively healthy. Now you can compare that with this eyelid here. So this is supposed to be a normal gland all the way back here, but you can see it's already started to die out or atrophy. We actually only have a few little parts of that gland actually producing oil. So that gland is already almost close to death entirely. You can see the other ones here are starting to shorten, and they're not as long as the ones on the good eye. And that's the same case for the upper lids. You can compare the two. Look how far back these glands go and how healthy they look, and look at these. These are starting to die out here, and that's going to contribute significantly to dryness. So one procedure that we do here that is FDA approved for this condition is called the Lipiflow. And what the Lipiflow does is we use an applicator on the eyelids. It heats up the eyelids to melt that oil back into a liquid, and then massages that eyelid to secrete the oil again. It basically gives us like a refresh or a restart on the eyelids, so that way they're less likely to die out or cause further problems down the line. Now the main purpose of that procedure really is so that the glands don't continue to further die out and you don't have worse symptoms in the future. Sometimes patients also get improvement in their symptoms, but the main purpose is really to prevent this from getting significantly worse, eventually leading to total gland loss and total death, and then really symptomatic patients. And that's a 15-minute procedure that we perform here in office. It's a pretty good procedure. And we usually like to do a full dry eye workup on our patients. We'll see you under your medical insurance. We'll see what the reasons and what the causes are of your dryness, and then we'll address it depending on what is the main cause of the dryness, what we recommend to treat that. So not every patient will need a Lipiflow. Not every patient will need prescription medications for dryness. Depends on really what we think the causes are and what we think will be best for you. So if you're feeling if you have dry eyes, if you're feeling those symptoms that I was talking about, you can come in under your medical insurance. We'll see you here at Offen Eye Associates, and we'll assess what's going on and what is the best course of action. Okay? This will be part one in a long series about dryness. Have a great day, and I hope to see you soon.